Hotline, the latest of those. Once again, Dr. John Vanchiere. He's an infectious disease specialist at LSU Health. Hey, Dr. John, welcome back to Keel. How you doing this morning?
Well, how are you guys?
Let's start here because I'm looking for a little good news this morning. A lot of news, and you can sort of clear up what's rumor and what's fact about a lot of possible treatments and or things that might at least control the coronavirus. Let's start with this malaria drug thing that I'm reading a lot about. Anything to that? Give us a little more detail.
Well, the drugs that are being tested right now all have shown some activity, at least in a test tube, for slowing down either this coronavirus or the 2002-2003 SARS coronavirus 1, we call it. So that's largely where the initial data is coming from and the excitement. And the NIH put out a call more than a month ago now, basically to all pharmaceutical companies, large and small, and said, send us some of your compounds that you've got in your freezer so we can test everything we've got in anywhere to find something to treat this virus.
Pardon me a second. You're not a kid. This ain't your first week on the job, so to speak. When you look at some of these things, when you read about them, I'm sure there are those based on your experience you immediately dismiss, but I'm sure that, like I said, based on your experience, there are those you go, there might be something to that. Is there anything specifically that might catch your eye?
Well, there are several good drugs that are used to slow down immune responses, and there are drugs that are used already in people. Monoclonal antibodies, they're called biologics, to treat diseases like lupus and the like, slow down the immune response. And those are the kind of drugs that are one kind of drug that's being looked at and tested. And clinical trials are coming along and going to be rolled out pretty soon by NIH and by several large pharmaceutical companies. So,
Doc, we're hearing about the new symptoms that it has some impact on your sense of taste and smell. That's kind of new. What can you tell us about that?
Yeah, I read about that yesterday. Very curious and a very unique symptom that a lot of people might just not, just say, well, I've got a cold, I can't smell or taste anything. That's something to pay attention to, I think, because that's unique, and that might be giving us an indicator of something to pay attention to. Yeah.
It's are you, as an infectious disease specialist, with the weather, heck, later this week going to be close to 90, are you among those who are encouraged that this may be a virus like so many others that are seasonal, i.e., as soon as the weather starts to get warm, it could just go away?
I think we have to be cautious about that interpretation. The long infectious period and incubation period argue against that, and so I think that's kind of a wait and see. I'm thinking the data I've looked at and models that I've looked at say probably going to be here with us for a while.
So that would make this an anomaly among other viruses of this type, right? Because and what I read could be 100% wrong, but
it already is an anomaly among viruses of this type. So I guess that would just add to its interest. Yeah.
Someone calls you today and lists some symptoms and wants to know if they should present to their doctor. What are you looking for? What are you going to hear that's going to say, "Ooh, you might be a case"?
Well, fever's a big one, and that's not the only one though, because some patients will have fever and some will not. What I actually saw recently, CDC has a symptom checker that is publicly available. You can go to CDC's website and actually look at and put in your symptoms and your fever and have you been exposed or not been exposed. And then it will actually tell you, you're recommended to stay put or to go get testing or to call your provider, those kind of things. So that's a really good place for people to start, so that they can actually put in their own symptoms and decide what's best for them. For the vast majority of people, remember, this is going to be a mild, moderate cold, a bad flu-like illness, and so the vast majority of people stay put.
Glad you brought that up. Are there any distinguishing factors in the symptoms or how you're feeling between this and the flu? Can you pinpoint anything yet?
Well, that change in your sense of smell may be one, but by and large, no. I mean, from a clinical perspective, if I saw a patient with fever and a sore throat and a cough, I couldn't tell you if it was flu or COVID-19 because those symptoms are very common, and there's not much that distinguishes those.
Is this, and this may seem obvious to you, but maybe not so much to me, is this something where if you develop symptoms and you go, well, I just got a cold, well, I just got some, that the longer you wait to seek medical attention, the more at danger you are?
So, for people at high risk, that may be the case. And what I've recommended is that, if you're feeling sick, contact your provider, let them know so that, they have you on their radar and can check in with you in a couple of days. But, and people are worried about getting tested, and testing helps us know how much activity there is in the community. It particularly helps in hospitals because we want to make sure that we're treating patients who are infected, using PPE, and those who aren't without, you don't have to use protective equipment, protective gear. We want to protect our healthcare workers. But from my perspective, it won't be long before testing becomes essentially irrelevant. There's going to be so much, so much COVID-19 disease around that really the only question is, do you need to go to the hospital or not? And the vast, vast majority of people know. We want them to start with their primary care provider. Talk to your doctor, talk to your nurse practitioner, whoever you see on a regular basis, and work with them to figure out, yes, you might need to be seen, you might not. But if you're really sick, if you're having trouble breathing, yes, that's the ones that we're mostly worried about.
Excuse me just a second. You said something to me that caught my ear. You said, pretty soon there's going to be so much COVID-19 around. And correct me if I misunderstood what you said. And the next thing you said was that physicians, that doctors are just going to assume that that's what you have. Did I catch that correctly?
That's not exactly what I said, but yes, I think that's, by and large, that's the case. That's what I think is going to happen.
Dr. John Vanchiere, you are a specialist in pediatrics. We've heard, and this may be a rumor, that some age brackets of children seem to be immune, but it's impacting other age groups. What can you tell us about which ages of children are being impacted?
So the data in children is, as we've said from the beginning, very reassuring because children are not getting severe disease. And we don't really know why that is. That's a big research question to sort out. And in fact, the number of pediatric deaths worldwide is less than a handful. I mean, that's amazing. So we don't understand that piece. That's a piece for me to sort out in the research lab, perhaps, and to do some more studies to understand. It may be that certain receptors for the virus are not active in kids, or there could be thousands of possible hypotheses, but that's got to be tested. The good news is, yes, very reassuring that children are not having severe disease, if any disease at all. And I think we can't really say they're immune to it because that implies that they already have some existing memory of a similar virus, mm-hmm. and we're pretty sure that's not the case. But we don't understand why kids are doing much better than the rest of us.
Interesting stuff. Thanks so much for your time.
Sure, anytime. Mm-hmm. Thanks,
Dr. John Vanchiere, infectious disease specialist, LSU Health. A pleasure as always, sir.